Hello everyone, I'm Dr. Deepa Agarwal. Greetings from Shishu, a beautiful space where I'll discuss, share and guide everything related to our priceless possessions, our children. This is my first official video on this channel where I will touch upon a topic which is very close to my heart as a child specialist. Yes, you guessed it right, breastfeeding. To nurture a life within herself and then later on is something which only a woman is blessed with. And breast milk, believe me, is the best gift you can give to your child. Why is breast milk so important? It is important both for the baby and the mom. Breast milk is species specific, nutritionally complete, is easily digested and absorbed by the baby. It has been seen that the babies who are breastfed for 6 months, they have a higher IQ scores. And it is equally beneficial for you also. The mothers who breastfeed as early as possible, it has been seen that the uterus involutes faster and the postpartum bleeding is less. Also, it helps in the faster pregnancy weight loss. I think that's a very big brownie point for you moms. Also, it has been seen that it decreases the risk of ovarian and breast cancer. So, how can we breastfeed? What are the problems which the new moms they face when they breastfeed? So in the subsequent videos, I'll touch upon the few concerns which most of the moms have when they are breastfeeding. So first I'll tell you how to breastfeed, how to initiate breastfeed, what are the best positions in which you should feed and how you should make yourself and your baby comfortable while breastfeeding. So it is very important that the breastfeeding should be started within first few hours and if not within first 24 hours of birth. So how do you breastfeed? Most important is the comfort level of you as well as your baby. So when you start to breastfeed, make yourself comfortable, preferably in a sitting position. Sit comfortably with your back rested so that you're not couching forward and you're not in pain. Then holding of the baby. How do you hold the baby? Now I will tell you how to hold the baby. There are many positions and there is nothing like right or wrong in a particular position. What is important is which position you and your baby is comfortable in and able to breastfeed properly. So there are many positions which have been described. The most important is how to hold your baby. Suppose this is a baby, this is the doll of my daughter which she gave me. So suppose this is a baby, you have to hold your baby like this. The head should be in line with the body. Hold it in one of your hands with the head resting on the elbow and the body well supported on your forearm. Now suppose you have to breastfeed from the left side. Your right hand is free, the 4 fingers are used to lift up your breast and this thumb will rest on the areola, which is the black part of the body. And you will lift your breast, press your areola, rotate the baby towards you. The baby completely should be rotated, not the neck should be rotated. The baby should be rotated towards you and the baby's tummy should touch your tummy. And then you bring the baby closer to you so that the baby's lip touch your nipples. Now when the baby's lip touch your nipples, he will start to open his mouth and start swallowing. At that moment you have to press your breast a little bit so that few drops of milk come out and he starts to open his mouth and swallow. And that is the moment when you have to latch on to your breast. So what is perfect latch? How do you recognize whether the baby has latched on properly or whether the baby is getting milk or not? So the perfect latch is, so when the baby latches onto your breast, the black part which is called the areola should be inside the baby's mouth. When the baby is latched properly, only a little part is visible from up and now down and the baby's chin is resting on your breast. And you can feel the sucking of the baby, a few slow sucks and swallow, a pause and then the suck. This is how the baby should suckle at your breast when the baby is latched properly. Suppose the baby is not latched properly, that means only the nipple is inside the mouth of the baby. So when only the nipple is there, there will be no milk secretion and the baby would suckle vigorously for few times and then the baby will get tired and then leave your breast and get irritated. So it is very important to position yourself and your baby properly to have a effective breastfeeding. So In my subsequent videos, I will discuss about various other concerns which you moms have while breastfeeding, like my milk is not enough, how much should I breastfeed, how much is adequate, what if my baby is not gaining weight on breastfeeding. So all these concerns I will discuss one by one in my subsequent videos. Till then, stay safe, stay blessed. Bye.